are back here on Carolina Women, and Maria, it's so much fun to have you on here talking about dentists and dentistry and all the great things. Dr. Robyn May has joined us.
Good morning.
I'm really excited that Maria's joining us because between the two of us, we had enough questions to last about 16 segments. So I think one of the first things we want to know is a little bit about you and your background.
Of course. So my name is Dr. Robyn May. I was actually born and raised in Cape Town, South Africa until the age of 9. I immigrated to Savannah, Georgia, where I went to undergrad.
Wait, ask her what she went to undergraduate school in.
What'd you go to undergrad school for?
Perfect question. Yeah. I did my bachelor's in cell and molecular biology.
I know.
What is that?
Basically, it's looking at cellular pathways and mechanisms, various different types, and understanding them on a molecular level.
And then did you want to be a dentist all this time? Did you always have interest in it?
Yes, I did. I think during undergrad, I was trying to decide between med school and dental school, and I shadowed a bunch of physicians and a bunch of dentists, and I just loved dentistry. I really did. I fell in love with it.
We have to ask her because it's really cute. You've been with ROC Dental for about a year now.
Yes.
And when we ask her so tell me about your ideal patient. What do you love?
My ideal patient? Honestly, I love the patients that take a little work to win over because it means a little more. You know, there's a lot of patients that come in, they're a little anxious. There was actually a study that was done by the American Journal of Dental Hygiene that said about 50 to 80% of adult Americans have some mild to severe dental phobia. So it is very, very common to see patients that come in anxious.
Do you have dental phobia?
I don't, but I was gonna say, I feel like it's shifted since I was a kid. Because when
Yes.
I was a kid, it was very much like sit down, and if you start crying, stop crying. And now it's like so much nicer when I go as an adult. They're
Absolutely.
so friendly, everybody's smiling, you know, it's not like, but I know a lot of people who have dental fear. And
Exactly. Well, at 71, I grew up in the era where if you had your tooth filled, but has it changed?
It's changed immensely. And I think that's one of the reasons that people do tend to have fears is they have experienced things previously where maybe dentistry hasn't advanced at that point yet. We use a lot of dental anesthetics now that help patients move through treatment fairly pain-free and comfortably, dare I say. And so those, you know, the advancements that we've made have gone a long way to bridging and making it comfortable.
well, a great example is the Invisalign
Yes.
that Dr. Calejo brought on. That was not, I mean, that was kind of coming around
Exactly.
what our age, and that was, you know, it was the big mystery of the plastic trays. No more braces.
No more braces.
Exactly.
So that's awesome.
What is the recommendation these days for people coming in for dental care? Is it once a year, every 6 months,
So
assessment?
depending on your gum health, we want to see you at a minimum every 6 months.
Okay.
And those appointments are really, really important for preventative care. So we want to catch things before they become worse and require more treatment or more time in the chair. So for a lot of people, preventative care is super, super important.
Do you see adults or adults and children?
ROC is mostly adults.
Okay.
We do see children here and there, but oftentimes kids are going to pediatric dentists for
So
treatment.
is an adult considered 12 and over? I mean, when do you like to see your first? So let's say I have 10 grandkids.
Yes.
And I can't imagine my 13 or 14-year-old going to a pediatric dentist. I
Yeah.
would think they would go to.
Yeah, I've had 12,
Yeah.
13-year-olds that come in and they feel more comfortable being in a space where it's not geared towards little kids.
Okay.
So.
Do you feel like people, I feel like people's smiles are one of the first things that I look at anymore.
Yes.
Do you too?
Oh, absolutely.
And
I mean,
how do
especially
you-
being a dentist, I can't
Well,
help
yeah,
but
exactly.
look at
Yeah,
people's
exactly.
teeth.
What is like one tip that you would have for people?
The most important thing I would say is preventive dental care is very, very important. There are a lot of people who, because they're fearful, push it off.
Yep.
And you're just asking for complications. You're asking for a minor problem that could be fixed in a 20-minute appointment to turn into something that requires a little bit more care. So really, really being consistent with your dental appointments, going to your hygiene appointments so that if there's anything that needs to be treated, we catch it early.
Dr. May, we
Yes.
really appreciate you coming.
Thank
That
you.
5 minutes goes really quickly.
It does.
We would love to have you come back on and talk a little bit more about all the things that you do. If
Absolutely.
you bring the new baby.
Absolutely.
I love it. Stay with us,
Absolutely.
more to come here on Carolina Women.